As we all know, maintaining a clean and sterile environment is essential to providing our patients with the best quality treatment. We do our best to make sure that our patients leave happier and healthier than when they came in. So why do we try so hard to heal them when we help create an environment that makes them sick? In Metro Manila alone, 3,700 healthcare facilities generate approximately 47 tons of medical waste every day. 56% of this waste, or the equivalent of 26 tons, is considered potentially biohazardous. These biohazardous wastes include infectious waste, such as human urine and feces, and tools like tissues and gloves that are used to handle them. Pathological waste like blood and body parts. And sharps like needles, syringes, broken glass, and other items that can cause puncture wounds or cuts. Exposure to these kinds of waste can spread many serious communicable diseases, including hepatitis, AIDS, and more. Since 2005, the Department of Health has required all healthcare waste TSD facility operators and healthcare waste generators with on-site waste treatment facilities to use DOH BHDT registered equipment or devices used for the treatment of healthcare wastes. However, more than a decade after this mandate, only 1% of all public and private hospitals have their own on-site treatment facilities, let alone ones that are DOH BHDT registered. Despite laws being enacted to promote proper waste management in the Philippines, little has been done to actually follow or reinforce these laws. The current situation is less than ideal, to say the least. In order to improve, we first need to know the current situation. What are we actually doing to manage our medical waste? The good news is that we follow the color coding system. For example, we segregate the non-infectious dry waste into black bags, the infectious and pathological waste into yellow bags, and so on. We also take great care to make sure that the wastes in these bags never get mixed. First of all, the black bags and yellow bags have different hauling schedules. Secondly, when the haulers arrive to take away the yellow bags, a hospital representative supervises the process. This is because it is a lot more expensive to haul yellow bag waste than black bag waste, and they need to be weighed properly to be priced accurately. The bad news is that some third-party haulers dump the biohazardous trash in improper areas that are beyond the hospital's control or knowledge. Trash tossed haphazardly into the environment pollutes it and endangers the communities that live nearby, communities that hospitals will eventually have to treat. That's why it's also up to the hospitals to make doubly sure that biohazardous waste doesn't get dumped improperly. Like it or not, hospitals are still accountable for the whole process, from segregation to hauling to treatment to disposal. So what can we do about it? One solution is that instead of blindly trusting third-party haulers to properly dispose of our biohazardous medical waste, we install on-site waste treatment facilities. That way, even if we don't haul out the trash ourselves, the waste we create is sterilized to the point that it becomes less harmful to the environment and the nearby communities. In the Philippines, the most common technology for treating healthcare waste is the thermal process. The thermal process can either use microwave or autoclave technology, both of which can use low heat treatment, or pyrolysis, which is a high thermal treatment method. The autoclave method is the most commonly and widely used technology in the treatment of infectious medical waste. It involves using boiling steam to sterilize waste and has already been used for many years in hospitals to disinfect reusable medical equipment. The challenge then is to build an on-site facility that uses the autoclave method to sterilize all medical waste generated by the hospital. Easier said than done, right? Except for the fact that it's already been done. That's where the TESALYS SteriPlus and SteriShred come in. SteriPlus and SteriShred are compact medical tools that allow users to transform infectious waste into non-biohazardous waste directly on site. This is important because, as stated in the DOH's Manual on Healthcare Waste Management Systems, healthcare waste that is properly treated with autoclave technology can be mixed with general waste and disposed of together. Utilizing industry-leading French-German technology, SteriPlus and SteriShred comply with the highest international standards. So how do they work? They first use the TESALYS system, a unique shredding method that uses powerful dual-shaft jaw-type shredders, which are 3 times harder than normal steel, to turn all types of organic and inorganic waste into tiny, unrecognizable bits. Air is extracted via vacuum pump to let the steam penetrate the waste better and ensure a uniform temperature. Steam is then applied and heated to 135 degrees Celsius for a total of 10 or 20 minutes. Afterwards, the steam is released, cooling the waste, which is now ready to be safely disposed of. No additional treatment required. The SteriPlus models are recommended for smaller hospitals with 10 to 100 bed capacity, while the SteriShred models are recommended for bigger hospitals with 101 to 1,000 bed capacity. Utilizing SteriShred and SteriPlus is an investment that will pay for itself in savings in short order. Assuming the current cost of hauling waste is 35 pesos per kilo and that a hospital accrues 500 kilograms of infectious waste per day, that's at least 17,500 pesos a day, or roughly 525,000 pesos a month that you could save instead of hauling out trash. They are simple to use, allow hospitals to save money used on hauling services, and save them the potential public fallout of finding their trash in some illegal dump site, courtesy of an unscrupulous third-party hauler. By using the TESALYS SteriShred and SteriPlus, we finally have a safe, simple, and cost-effective way to minimize harmful healthcare waste, creating a cleaner, healthier environment for Filipinos throughout the country.